Okay, now we're doing a hidden history of health and science by me, P. Rogers. This is part 2. We're on page 2 of the book. Actually, we're on page 3. On page 3 of the book. Okay, so it starts out here with this picture called the pit of doom. And this is where most patients are. Most patients don't get better. They have terrible outcomes, okay? It's a big joke. They take their pills, they get their surgeries, they die a miserable death, broke and suffering. And they go to conventional medicine for chronic problems that don't respond to drugs and surgery. Because what are most people going to die from? They're going to die from diabetes, hypertension, atherosclerosis. In the movies, people die from bleeding. In real life, they die from clotting. Clotting up the arteries of the heart. There's a heart attack. There's atrial fibrillation. There's congestive heart failure. There's a stroke. There's ischemia of a tissue that becomes cancer. Okay? Adequate blood flow is essential for optimal function of any organ in the body. So I call this the pit of doom, the functionally illiterate, conformist, trusting proles. They go to conventional medicine, they hand them the step ladder of drugs, and the drugs don't work. Versus, smarter people, I call this the attitude divider. So it always rains on them. They just got one sob story after another because they never get better. Okay, and then here's the sun shining. The person says, screw that, I'm going to help myself. And here's the internal medicine doctor saying, yep, the patient has all the power. Learn about diet, filtering water, how to exercise for what you can do, getting your sunshine, being religious, having a purpose, improving your sleep, constantly improving your health habits. And you'd be amazed how dramatically many people can improve. Okay, so the two most dangerous words in the nutritional world are good fats. Good fats is like a hypnotic phrase that turns a lot of people just into morons, and they start looking for good fats. There's no such thing as a good fat, okay? All the lipids are bad, okay? You need a minimal amount of omega-3, ALA, C18, 18 carbon molecules, and omega-6s. Such a small amount, you'll get it automatically from eating a plant-based diet. Automatically, easy. It's impossible not to get it, so I wouldn't worry about it. They just make up tests to sell you stuff. Okay, here's a quote from Nathan Pritikin. He said, the best way to characterize diets is by the amount of fat. Nathan Pritikin's reviewed all the literature on dietary lipids, and he came to the conclusion, fat is bad. They're all bad. Okay, McDougall, same conclusion. It didn't matter what fat you fed the patients. They all increased the risk of atherosclerosis, like in the David Blankenhorn studies. But none of this is in the conventional medical books, conventional nutrition books, biochemistry books. Lorraine Day, she said, in 100 years of Nobel Prizes in medicine, the only ones that actually helped people were discoveries of vitamins, and God made the vitamins. That's actually true. She wrote a real funny book chapter about that. I think it was in her book, I'll Give You Back Your Health. And so what's funny about it is people get a Nobel Prize when they, in medicine and physiology, when they do research that's going to help to sell drugs, like discovering the receptor, for LDL cholesterol, or figuring out the pathway for statins or something, but not for actually helping people. Most common cause of death is a heart attack. Dr. Caldwell-Esselstyn says that if anybody truly follows his diet, they never have a cardiovascular event. Atherosclerosis just doesn't occur. Framingham study, if they kept their total cholesterol below 150, they didn't get atherosclerosis. Okay, so that's a very, very doable thing. Okay, here's a quote from Dr. McDougall. Dr. McDougall said, the cure rate for coronary artery disease with drugs, stents, and surgery is 0%. 0%. So look at that. With the vegan diet, low-fat vegan diet, you have a cure rate of approximately 100%. If you go man's way, you have a 0% cure rate. Yet 99.99% of people, they all go man's way. They take drugs, they go for coronary artery stenting, and they go for open heart surgery, CABG, coronary artery bypass graft. Okay, most people are fundamentally stupid. And the doctors don't know nutrition. They don't know it. Conventional medicine is where you go to buy drugs and surgery. So if you think drugs and surgeries are the answer to your problem, that's where you go. And for a lot of things, that's what you need. If you got hypothyroid, to replace your thyroid. If you got type 1 diabetes, fine. But for a lot of other things, just fix your diet. Okay, and like I said too, you can't get bigger odds than that. 100% cure rate for the most common cause of death with a low-fat vegan diet versus 0% cure rate with man's thing. What's confusing about that? What's ambiguous about that? There's nothing ambiguous about that. If that doesn't seem clear to you, then go away. This page will be too difficult for you. That's as simple and obvious as it gets. There is nothing in life where you'll get a better deal than that. Yet nobody wants it. It's amazing to me. Okay, and there it is. The low-fat vegan diet is the holy grail of health, and this has been shown. I'm going to show how this has been proven backwards and forwards over and over. There is no controversy. There is no contradiction. There is no ambiguity. This is known. Okay. All right. And when I say low-fat vegan, I'm talking low-fat, low-sodium, 100% organic, 100% whole foods with a single ingredient only one ingredient, with no oil, not one drop, no caffeine, no sweets, no alcohol. Typical people eat the SAD diet. SAD diet, standard American diet. I also call it Dumbo diet. Dumbo is D for dairy, U for ultra-processed foods, M for meat, B for beer, O for oils, S for sweets. Okay, it's for chumps. And just because you got away with it when you're 20 years old doesn't mean you're going to get away with it as you get older. Okay, now I know this book's supposed to be about history, so we're going to start getting into the history of health. And you know, all the old stuff is boring. Yeah, Hippocrates was a little more empirical. He studied his patients. He kept track of their progress. He didn't attribute everything to, you know, the pagan gods. You know, said you're sick because Zeus is mad at you, or Athena, or one of the other gods, Artemis or something. No, he said it's because you're doing something wrong. So he was on the right track. Galen, you know, said a lot of stupid stuff. The doctor in the days of ancient Rome. Then they started learning about nutritional deficiencies, you know, like with scurvy and beriberi with the sailors. You know, scurvy, you can cure that by eating fruits. Beriberi, you need a little more variety of diet than just eating white rice. Okay, so that's nice, but hardly anybody has a nutrient deficiency disease anymore. You know, I've never seen a case of scurvy or beriberi or pellagra, okay? I've been a doctor about 35 years now. Nutrition gets real interesting about the 1920s. And the first person that gets interesting with is Otto Warburg. So Otto Warburg was this genius biochemist from Germany, real stuck up, you know, deservedly so, okay? Here he is. He's the guy who figured out the Warburg effect. Basically, that if you deprive human tissue culture cells of oxygen, just drop it down by like more than 35%, they will sometimes convert into cancer. And he assumed this was due to injury to the mitochondria due to lack of oxygen. He assumed it was like electron transport chain, to the best he understood that. He didn't really understand the biochemistry in those days. But hypoxia-induced mitochondrial injury leads to a transformation of a cell, instead of being oxidative like almost all the cells are in the human body, to becoming anaerobic, running without oxygen, just running on glycolysis rather than glycolysis to Krebs cycle to electron transport in the mitochondria. And so he said, if you want to prevent cancer, maintain good blood flow. Okay. And the reason why I started with Otto Warburg was he is the guy who trained both Walter Kempner and Hans Krebs. Hans Krebs is the guy who figured out the Krebs cycle, you know, the tricarboxylic acid cycle that runs in the mitochondrial matrix, also called the citric acid cycle. And then he also trained Walter Kempner. So Walter Kempner is like the grandfather of nutritional therapy. Okay, then next in line would be Dr. McDougall. He's like the father of nutritional therapy. And I don't know what you call me. I'm like the grandchild, the prince, okay? Okay, if you want to make metaphors to culture, Walter Kempner would be like the ancient Greeks and Romans. Pritikin and McDougall combined would be like the Renaissance. And I'm like the Belle Epoque, the 1800s. The 1800s was a really high point in culture for anybody that studied it. You could call the 1800s the Victorian Renaissance. You could call it the Belle Epoque in France. You could call it the Golden Age, all right, of Europe. It was. The 1800s is an amazing time. Anyways, we're going to talk about Walter Kempner. This guy was an incredible genius. And what Walter Kempner did is he proved that most of the chronic diseases are all preventable and curable. And nobody knew that before he came along. Okay, everybody thought it was impossible to cure these diseases. He looked at these Asian people and he said, look at them, they're all skinny. All these white rice eaters, they're skinny. They don't have type 2 diabetes. They don't have hypertension. Well, if they get hypertension, if they smoke and eat a lot of salt. But he says, just from eating that white rice diet, they're healthy. And they were eating like 85, 90% of their calories from white rice. So he started putting people on white rice, just Uncle Ben's rice, okay? And white rice is only 1% of calories from fat, okay? And Kempner started getting amazing results. Reversal of coronary artery disease on EKG. Reversal of ophthalmic exam in the eyes of diabetic retinopathy, of hypertensive retinopathy. Here's a really good book about him. It's written by Barbara Newberg. She was an internal medicine doctor who worked with Walter Kempner. He was an internal medicine guy, but he'd had a lot of training in kidneys, nephrology, and done research in that. This is one of the Rice houses, so the people are staying at the Rice house while they're in Durham, North Carolina at Duke University to be treated by Dr. Walter Kempner. So the great thing about the rice diet is it works. It cured tons of people. The bad thing about the rice diet is it's so narrow, being primarily just rice and fruits, and then you give them a multivitamin, and basically they had to be monitored. He was checking their labs and stuff. These people initially were very sick, especially initially for hypertension and for kidney failure. Later on, they started coming to him more for obesity. Okay, so here's a book of scientific publications by Walter Kempner. There's a volume 1 and a volume 2. They're both at drmcdougall.com. The volume 1 is in German, so I can't read it. But the volume 2 is in English. And it's pretty obvious the things that Kempner says. I mean, for example, people say, oh, the reason your patients lost weight is because you starved them. And Kempner said, no. You can look at their nitrogen balance. They had positive nitrogen balance. Those kidney failure patients, too. They maintain their serum albumins, which is an indicator of overall protein status in the body. So he knew what he was doing. He could tell what was going on just looking at their urine electrolytes and protein. Here's the Kempner diet. It was about 94% carbohydrate, only 4% protein. And he didn't give them amino acid analogs. There was no supplements, just 4% of the calories from protein. And he gave them 2% of calories from fat. That's like the lowest diet you could get in fat and the lowest you could get in protein. Extremely low fat. And that's what cured everybody. That's why, in all these BS artists, the high-fat phonies try to tell you that, their version of the Mediterranean diet, about 40% of calories from fat, is going to help all these people. I'm like, yeah, right, spare me. Okay. Kempner was 10 times lower than them in fat. 10 times lower. More than 10 times lower. He was 2% fat. He was 4% protein. He was 2% fat. So he was literally, how many times does 2 go into 40? 20 times, okay? 20 times less fat to cure all these people. McDougall says his diet probably ends up, it varies a little bit in the ballpark of about 7% of calories of fat. Esselstyn says he's less than 10%. Mine, when you look at it, Spartan vegan diet, it's right around like McDougall's 5 to 7%, something in that ballpark. McDougall says Kempner diet is the diet for the nearly dead. It's very boring, but it has a great effect on health. What McDougall did was he switched them. Instead of just being rice and fruits, he's primarily making it starch with a little bit of fruits and vegetables. He actually recommended for a new person to nutritional therapy, start out with 90% starch and then 5% fruits, 5% vegetables. And that'll make dramatic improvements in the health of the vast majority of people. So his diet wasn't quite as powerful to cure people as Kempner's, but it didn't require monitoring. And for most people, it was good enough. Okay, here was a funny book written by one of the patients over there, this lady, Jean Renfro, Fat Like Us. She made all kinds of jokes about what it was like going to the Mecca of health and nutrition to see Dr. Kempner. He's like the Wizard of Oz of health. He was the best doctor in the world for his time for a long time. He cured like 19,000 patients or something. Rather incredible. People all over the world would flock to North Carolina to be treated by him. Okay, the patients would get on a scale at the Rice houses. They would have weigh-ins, and every day they would check their weight. They would weigh in front of the other patients. They would eat their meals together, which was good. They get to talk to each other. The ones who lost over 100 pounds, they would get their pictures on the wall, the Centurion Club. They would post their blood pressures on the wall so everybody knew how you were doing. Okay, you couldn't BS things that well. And then here's an example of a retinal exam reverting to normal. Okay. He would have them. He had lots of people. They didn't even trust him at first. He kept close records on all his patients, and here it is, curing these diseases. Nobody could believe that these diseases could be cured. And he made the point, Kempner. He said, "Look, the important thing is not so much the rice diet. The important thing is the fact that these diseases are curable." He had patients with congestive heart failure. Their hearts would shrink back down to normal. They were losing incredible amounts of weight. Somebody asked him, "Have you ever had a patient lose 100 pounds?" He goes, "Yeah, sure. Here's 100 of them." And he, gives them over 100 patients that lost over 100 pounds. Okay. Oh, yeah, and Dr. McDougall basically said, you know what, because people try to challenge him all the time. He says, don't even think of challenging me until you've read Kempner and Pritikin. I would agree with him. You know, and you should read McDougall now too. If you want to have a clue about nutrition, these are the guys, the most important pioneers in nutrition. You have to read them. Kempner, Pritikin, and McDougall. They're like the foundation of the whole thing, okay? And then you start getting into specialists who develop specific areas, okay? T. Colin Campbell on animal protein and cancer. Caldwell Esselstyn on low-fat vegan for coronary artery disease. Richard Moore on the issues with regard to potassium and sodium and hypertension. Gregory Sloop with regard to blood sludge and atherosclerosis. You know, Swank, Dr. Swank with regard to multiple sclerosis. There's like people who establish the foundation of a field. And if you want to know that field, you have to read them. Otherwise, you don't have it, okay? The best book Dr. McDougall ever wrote was Starch Solution, okay? He was sort of the best doctor in the world then after Dr. Kempner retired, okay? And then died. Okay, all right, next is going to be Dr. McDougall. So we're going to leave it at that today, having discussed Walter Kempner. So Kempner set the foundation for it all, showing with low-fat vegan diet, you can cure obesity, type 2 diabetes, hypertension. You can often save kidney failure patients. Sometimes you can't, they're too far gone, but you can often save kidney failure patients. Before then, there was no dialysis. Patient just goes into kidney failure, they're dead. Okay, you can often reverse autoimmune disease, congestive heart failure, atrial fibrillation in some patients, CHF in some patients. So anyways, there it is. I hope you found that helpful.